This is Damien, and we are going to do a bit of an experiment. He's got 2 tennis elbows, so we're only going to treat one, and we're going to treat it a number of times, and we're just going to see what happens and have the other one as a bit of a comparison. So how long have you had the tennis elbows?
About 12 months. Yeah.
12 months, right. What caused from it doing anything repetitively, or?
Well, it was from weights initially, and then I remember there was one defining moment that I'd done a considerable amount of laborious work in the backyard, tiling, and after that day, both elbows had, both arms had suffered since. And it hasn't fixed itself after.
So it's in that, if you make a fist, and just push back a little bit. Okay, how's that feel through there?
Yeah, so I get it from through here, this part of my
arm. Okay, that's it.
Yeah.
Alright, so that's the extensor tendon. So, turn this this on. Now the only danger with laser is you can't look at it like any laser.
Yeah.
Because you damage your eyes. You've got to wear these funky glasses.
Right.
And so have I. Right. And we're off. Okay, and that is it. 10,000 joules. How's it feel?
Yeah.
Warm?
Yeah, warm, and like I can move it a little bit better, yeah.
Alright, well let's give it a go in a few days, see how it is.
Okay, great, thank you.
So this is the second treatment for Damien for his tennis elbow. So any change yet?
Not as yet, no.
Nothing yet? Alright, well we're going to give him a slightly bigger dose today. We've got a bigger machine today, 4 times the size. So the dose is going to be about double what we did last time. Okay. So you'll feel the heat there, yes?
Yeah, I can
feel it. It's a lot hotter than the other one, isn't it?
Yeah.
So the treatment's going to be a lot quicker. Okay, so that's all done. So how's it feel?
Yeah, great. Yeah, it's nice and warm and easy to move, and I can't feel any pain right now, that's for sure.
Okay, yeah. Right, well, we'll try it, see what it's like next time, give it a few days.
Okay, great.
Right, Damien, so treatment number 3.
Yep.
How did it go after treatment number 2?
Treatment number 2 felt good when I left, but I've found a small difference 2 or 3 days after that. Yeah. And by doing a few lift tests, when I first started, before the treatment, I had a similar amount of pain in both arms. And by doing those same tests, I'm finding that, yes, there's still pain, but it's a less amount of pain than there is on the right. So something must be working. Yeah.
Heading in the right direction?
Yeah.
Okay, sure. Right, we'll pop those on. We will get to the other arm at some point.
It's good.
It's good to have a comparison.
Absolutely, yeah. Because, you know, if I didn't have that comparison, I'd say there was still pain there, but now that I know there's a difference, you know, that I know it's working or something's happening, you know.
Something's happening, yeah. Okay. Treatment number 3 done.
Fantastic.
Give it a week.
Yep.
And we will we'll check it again.
Thank you.
See you next week.
Okay.
So, how are you doing, Damien?
Well,
is this number 3 or number 4?
This will be 4.
4, okay. Yeah. Alright, so I haven't asked you yet how your elbow is.
It's noticeably better.
Right.
I can hand on heart say I'm actually feeling a difference. It's not, I mean, I still have pain, but comparing it to the second one, I can definitely notice the difference. So, yeah.
Alright, so we're on the right track.
Yeah.
Out of 10, you know, like percentage-wise, what would you say if
Yep. Okay,
the elbows are 0 and completely gone 100%?
Yep. So I'd probably say we're tracking around, so 30%. I'd say 30% better.
30% better, yeah. Sweet. Right. Yeah. Okay. We're getting there.
Yeah. Like I said, I mean, I could not lift anything, you know, in that motion, whether it was, you know, 3 kilos or 30 kilos, you know, it was that the pain that came down there. Now I'm not getting that, you know, it's still painful, I can still feel it, but, you know, I can do it now, whereas before I couldn't. So.
That's good. All right. Well, you got glasses? Yep. Here we go. Now, believe it or not, this is a bit of a slow one. would have expected you to be 60 or 70% by now.
Yep.
So it's still working, but
Yeah.
it's they're all different. It depends on the level of injury. But as long as we're heading in the right direction.
Mm.
How you going, Damien?
Good, thanks. Good.
Very good. So how's the elbow going?
Yeah, it's this top part of the arm is a lot better than it was last week even. And no, I tested it by doing some weights a few days ago, and yeah, there's a big difference between the two arms.
Okay.
So yeah, it's
Good.
part of
Compared to the other arm, if the other arm is a 0 and completely fixed would be 100%, where's this arm?
I think it's probably around about 60% now, 60,
Okay.
65, 70, around those marks.
Good.
I do still have a bit of pain down this part of the arm, but yeah, where you've been concentrating the laser on the top part is
That's
seems
good.
to be good.
Right. So there's a bit in this area here.
Yeah, that's it right there where you.
Right in there.
Yeah.
Okay. And if you just gently pull your hand as if you're using your bicep. Okay, relax.
Yeah.
So it's in there.
Yeah.
Okay.
Yeah.
All right. So you've actually got two problems. It's just where the biceps attaches in and the brachialis attaches in to into your forearm there.
Yeah.
That biceps tendon's got a little bit of trauma on it as well.
Mm-hmm.
So what we'll do is we'll bring the laser around. So this bit's feeling good.
This bit's great. I'm tight.
Okay. All right. Well, that's the tennis elbow.
Yeah.
So what we'll do this, but we'll also do a little bit around
Okay.
the biceps as well.
Right.
All set.
So just keep my arm like that.
Yeah, just keep your arm like that, and I'll move around. Just if it gets a bit warm, let me know.
Yeah.
Very good. All right, all done.
Thank you.
Until next time, maybe early next week.
Yep.
Give it another whirl.
Fantastic. Thank you. Yes.
How's it doing?
Very well. So
Yeah.
the top part of my arm, which you've diagnosed as a tennis elbow, I would say is more or less fixed.
Right.
It's only now down here
Yep.
where I think you've indicated it's another
The biceps.
bicep
Yeah.
injury, and then so that's still giving me trouble.
Yeah.
But this part I can lift anything that way now, no problems.
Okay.
Yeah.
Good. All right. Well, let's do another one, and we'll just focus on there.
On
And
this part, yeah.
okay. There we go. And just let me know if it's too hot. So what we might do next time is start on your other arm.
Okay. Yep.
Just give this a top up. Good.
Beautiful.
Excellent. All right. Well, I'll see you next time.
Okay. Thanks. Yes.
Where are we up to with your tennis elbow and then the biceps?
So the bicep, as I discussed a couple of sessions ago, was pretty raw, pretty tender. After the last two sessions, I can honestly say that there's been a huge improvement in that.
Yep.
The tennis elbow is virtually gone.
Yep.
And I'm probably at 80-90% with this. So
Okay.
it's very good.
All right. Okay. Well, today we'll treat both, and then we'll just circle back after that one. Hopefully, when that one gets fixed.
Yep.
After that one gets fixed.
Fantastic. Okay. Great.
All right.